Next, we're going to be reviewing ultrasonic and sonic instrumentation, which is also known as electronically powered instrumentation, which uses rapid energy vibrations of a power instrument tip to fracture calculus from the tooth surface. These instruments were designed with the goal to make calculus removal easier and faster, with less patient discomfort and clinician fatigue. So since we're able to remove the calculus, it's fractured off of the tooth, it's a little bit easier for us to remove when we have a difficult patient. These instruments are great to use because it will lessen our fatigue, because obviously we're not just seeing one patient a day, we're seeing many patients a day. So it will help us with our fatigue throughout the whole day to allow us to provide all of our patients with the best care. There's definitely, with everything else, advantages and disadvantages of using these instruments, and we're going to go through those today. Advantages over hand instruments are it's easier for the removal of calculus. These instruments are great for the removal of plaque. We call that deplaquing. It disrupts the subgingival plaque biofilm from the root surfaces and pocket space. And we are able, as you can see in this picture, able to better get access to our furcations as well due to the shapes of these instruments, due to the thin tips they have, and once again due to its ability to really blast that tartar or plaque away from the tooth surface or root surface. Some other benefits of these instruments, it's conservative with the cementum. We know the cementum is a very soft structure in the tooth, so it will be very gentle on that when used on the correct power settings. Once again, it's great for pocket penetration. If you have a deep pocket, if there's plaque at the base of that pocket, the lavage and the irrigation from this, which is actually the next beneficial side effect of these instruments, is great for flushing out that bacteria and plaque. And its bactericidal effect is also great because we can reach the biofilm slightly beyond where our instrument ends because of the power tip and because of the water it is flushing through. And just like we were talking about with clinician fatigue, we are actually able to have shorter instrumentation time because this instrument allows us to blast that tartar and plaque off a little bit easier. As with anything, you have benefits and then you have limitations. So some of the limitations of ultrasonic scalers is the aerosol production. Aerosols are airborne particles dispersed into the surrounding environment by dental equipment, such as high-speed handpieces or these electronically powered instruments. These, aerosols can land on your lab jackets, can land on the counters, so you just want to make sure you're using proper surface disinfection, and barriers are extremely important when using these instruments. This also has an effect on cardiac pacemakers, meaning patients with cardiac pacemakers, you cannot use the magnetostrictive ultrasonic instruments on these patients. It will interfere with certain types of cardiac pacemakers. Now, another type of sonic instrument is the piezoelectric ultrasonic device, and you can use those on patients with cardiac pacemakers, but not the magnostrictive. Another negative side effect with these instruments is the reduced tactile sensitivity. With our instruments, we're able to feel with our fingers that we're holding the instruments with, whether there's tartar or calculus still on the teeth. With these instruments, we lose all of that. So you are purely going by looking at x-rays or feeling with your Explorer before using these instruments. And the last big limitation with these instruments is infection control. So you just want to make sure you're protecting yourself as well as protecting others. So one great way to really promote infection control when using the ultrasonic instrumentation is to use a face shield, as noted in this image here on the screen. So ultrasonic and sonic instrumentation has great benefits. It also has some side effects you want to be cautious of, and otherwise they're great instruments to use for difficult patients with heavy tartar loads or generalized heavy plaque loads on the teeth.